everybody. Doug Pfeiffer from the Resilient Purpose Podcast. Welcome back to another episode. So today I wanted to talk about, I guess the real big topic of the day is the impact of COVID and kind of where the state of our community and society is in terms of COVID and all the decisions that, are being made and how we're reacting to those decisions and what does that mean for ourselves, our lives, even our kids, and just kind of wanted to speak specifically to what's going on in our society and then connect it to our mental health, because that's what we talk about. We talk about mental health and COVID, and all the different ways that we're experiencing COVID certainly impacts our mental health. And clearly one of the reasons why I wanted to speak about this today is that it is clear that, people are struggling right now. And not necessarily because I've looked at like unemployment rates or things like that, but we just see so much out there of people just having difficulty with mental health, struggling to cope, having maybe acting in ways that, you normally wouldn't have acted in like public meetings and things like that. And just kind of going, having real outbursts about things and just getting really angry and just, just you clearly can see the stress that is worn all over people's faces, and bodies. And no doubt, it is a very stressful time. We don't know what's going to happen. We don't know if things are going to shut down. We certainly have big concerns about, governments and entities making mandates about wearing masks and getting vaccines. And, how do we really feel about that, of being told what to do and what that's like for us? So I thought it might be helpful to really talk about, what is more likely to create mental health problems, or how we can take something that we know is in a global perspective very stressful and very overwhelming for people, but when we individualize it, knowing that there are things that we can do to lessen the impact of it, or to provide what we would call buffers to that's experience of stress, and change. Because oftentimes I think our mental health deteriorates when we feel so out of control. And so I think it's really helpful to talk about things that let us know that we are in control. There are things we can do. We can regain control, and just feel better, even though things might be around us kind of falling apart. So I thought it might be helpful to kind of quickly just talk about stress and kind of relate it to COVID. But one of the things that you've probably heard me talk about before, and I usually keep coming back to it because I think it's really that important, is that, stress is not inherently bad. And in fact, we can't grow and get stronger and develop unless we're pushed out of our comfort zone, which means we're stressing our brain and we're stressing our body. When you physically exercise, you're stressing your muscles, and that's how they get stronger. You're pushing them, to where they're really tired and exhausted. Now, of course, we need recovery periods when we experience stress. So there are certain things that we need to keep in mind about stress that determines whether we're going to be vulnerable or whether we're going to be resilient. So it is actually not stress itself. And so that's why I want to go back in relation to COVID. It's not events itself that necessarily are what makes it stressful or traumatic or whatever, but how we experience that. Like, our experience of a particular event determines whether something is traumatic or not the event itself. And that's why you'll have different people experience the same event, and one comes out really traumatized by it and one does not. There are many factors into what determines whether something is stressful to us or not. Our own history of experience, our genetics, how resilient we are to begin with in terms of life experiences and being able to overcome adversity, all sorts of things like that. So when we look at stress, you actually want to look at the pattern of the way we experience stress. And so Dr. Perry has a really good kind of formula for this pattern in which we experience stress that helps us determine whether we're going to be vulnerable or resilient. And so that pattern is pretty simple. When stress is unpredictable, means we don't see it coming. It kind of feels out of nowhere. We didn't kind of prepare for it. When that stress is unpredictable, severe, so it is a stress that pushes us not just out of our comfort zone, but way out of our comfort zone. It overwhelms our system. And then thirdly, if it's predictable, if it's unpredictable, it's severe and prolonged. If it's prolonged, meaning it goes on for longer than we expect and we don't have this opportunity to recover. So like when you go to the gym and you work out for a time limited period. So you work out for an hour and then you're done and then you go rest. You might have a recovery shake and all these sorts of things to recover. You stretch, you do these things to take care of yourself. So when we experience stress in a prolonged way where we don't have any recovery, that's where it actually creates vulnerability. It sensitizes our stress response, which means we become overreactive. We lose control easily. We overreact to little things. So things that normally didn't bother us now bother us a whole bunch. So we become less and less capable of being able to tolerate what we're experiencing in life. So now that's the bad news. The good news is there's a pattern that builds resilience. So there's a pattern in which we experience stress that builds our resilience. And so that pattern is pretty simple. If it's predictable, so we know the stress is coming and we can prepare for it. If it's moderate, so it pushes us out of our comfort zone. Now that is key. It has to push us out of our comfort zone. But it's not so big that it overwhelms us. And then thirdly is that we have some sense of control in there. So that might be related to choice. That might, we can express when and how we experience certain stressors. And so when that happens, we actually build resilience. If we can experience a stressor that pushes us out of our comfort zone, but we have some control over it and we know when it's going to happen in a pattern and predictable way, we will actually build resilience. So let's take COVID, for example. What has been more unpredictable than COVID? Not much. I mean, COVID is certainly very unpredictable, and now there's all these different variants, and we were doing well, and now we're not, and hospitals are being overwhelmed, and there is significant amount of people that are not doing well, and so people and entities like schools are kind of getting really concerned and making decisions in response to this crisis. So it has certainly been unpredictable. When is this ever going to end? We don't know. We sometimes struggle in terms of being able to prepare for this type of crisis. It is severe. It certainly is severe. I mean, like I said, hospitals are overrun. People are on ventilators. People are in the ICU. People are dying. There's severe stress. So not only for people that are contracting COVID, but also for people that are having to quarantine. They might not have COVID, but they're having to quarantine and isolate. And so that reduces their socialization, that reduces their ability to connect with others, their ability to learn in school and all sorts of things, or even go to work. But also people losing loved ones, or people's loved ones being in the hospital, and the stress that plays on us. So that certainly is huge. And then also it's prolonged. I mean, we're going on 2 years of this, and it doesn't seem to be slowing down. So certainly this totally makes sense in terms of why people are struggling. We're becoming vulnerable. Our stress response is becoming sensitized to things. We're having a hard time dealing with things because our stress response has changed to being more vulnerable. So we as people might have been resilient pre-COVID, and now we're really vulnerable. People might, and then of course we always worry about the people that were already vulnerable from their own life traumas, and now where do they go with this change in stress? So when we are talking about COVID and all the things that are going on, it's really important to see how can we shift something that is unpredictable, it's severe and it's prolonged, and how can we shift it into the pattern that builds resilience? How can we make the unpredictable more predictable? How can we allow ourselves to have more control in terms of how we experience stress? And I think that's going to play a huge role. And so one of the things I wanted to talk about also real quick was it's called the ACEs study in terms of kind of how we look at COVID and what we think it causes, or how some of the decisions that people are making in terms of COVID and whether it causes mental health problems. And so I wanted to kind of put things in perspective for people that that we don't want to make a very black and white causal relationship between COVID and mental health problems, or mask wearing and mental health problems, or just even being able to, how do we handle the fact that people are wanting to mandate vaccines, and how do we deal with that? So, and this kind of goes in line with stress and how we experience stress, and also plays a role into some of the research outcomes that we've seen with the ACEs study. But the ACEs study, real quick, was a study that was done in the 80s by a researcher, by Dr. Fellini. He ran a weight loss clinic, and he started making this connection between adverse childhood experiences and problems with weight, obesity, and then even weight loss and keeping the weight loss. So we created a study, and the study was 10 questions, and these 10 questions illustrated a type of adverse childhood experience that we might experience: physical abuse, sexual abuse, domestic violence, losing someone to suicide, drug addiction in the family, things like that. And so he would give this screener, 10-question screener to people. It was 17,000 people, and they would mark how many of them experienced one of those ACEs. So one of those questions they answered yes or no. And so then they compared the number of ACEs people identified in their life, and over time looked at health outcomes. And the big thing that came out of this study was kind of really brought to light the impact of trauma on our well-being, our physical well-being and our emotional well-being. Because what this study showed was, from a very global perspective, it was an epidemiological study, so it was about correlation. So the more ACEs we had, the more likely we were going to have physical health problems like diabetes, disease, cancer, things like that, or behavioral health problems, addiction, things like addiction to smoking, drug and alcohol use, even intravenous drug use, more likely to want to or have suicidal problems or take our life, things like that. So if people had, even some of the statistics showed that if people had 4 or more ACEs, their life expectancy reduced by 20 years. So it was going to have, significant impact on our overall health. So it was really good. I mean, it was a really good study because it really brought to light, even though these statistics were really, disheartening and sad, it really brought attention and light to the fact that, people that get a lot of adversity, these adverse childhood experiences are at a high risk, and so we have to provide some type of intervention. We have to educate people about the impact of ACEs so that we can put programs in place and supports in place that we can reduce the impact of these adverse childhood experiences. These things were replicated. Kids in school, kids that had ACEs were more likely to have truancy problems, trouble with grades, behavioral challenges in school. So these things have been replicated, that from a global perspective, when you look at a mass number of people looking at this study, there's certainly higher risk. The interesting thing is that there was a recent study, because I think people started to kind of make this conclusion, or we didn't want people to kind of think that if you had these ACEs that, oh my gosh, your life is done, there's no turning back. So they looked at things from an individual perspective. If you gave someone the screener and they had these ACEs, how predictive was it for this individual? So if I filled out the screener and I hit 4 ACEs, how likely is it that I was going to have health problems? And so what that study showed, actually, that it was a very poor predictor of health outcomes. That You couldn't just give somebody the screener and then it would just automatically mean that they were going to have these health problems or behavioral health problems. It just wasn't that way. Well, that's the thing about correlation. It's a comparison. It puts people at higher risk. So when you look at greater numbers, that is true. But when you look at somebody individually, that is not so true. And there's a couple things. Number one, the ACEs study didn't take into account someone's relational health. There's a lot of research around someone's relational health and positive outcomes and resilience and being able to deal with adversity. That what people have adverse childhood experiences, but they have a really good, strong, healthy, safe support system, good relational health, they actually end up getting stronger or having resilience of being able to kind of be successful in life. And there's countless examples of people like that. Oprah Winfrey, certain athletes that have come forward about their adverse childhood experiences and being able to overcome those factors. So there's a lot of people out there that have demonstrated that even though you have these adverse childhood experiences, it doesn't mean that bad things are going to be in your future, that you can turn things around. And so that is really something that we really want to keep in mind. Now, if they have ACEs, we want to kind of learn a little bit more about that person's life and what they might need. Is there strong relational health? Are there other protective factors in place? Because the likelihood is if you have all these ACEs and you don't have any relational health and you don't have any resources and you don't have any supports, that those health problems are likely to happen, more likely to happen. But you have protective factors and buffers that can actually stay off the outcomes of ACEs. Dr. Perry's work in the neurosequential model, there's a lot of research that supports the work that they're doing, and some of the research through the NMT brain metrics shows that relational health outside of the first 2 months of life is a stronger predictor of positive outcomes than adversity is a predictor of poor outcomes or challenges later in life. So we know that one of the first things we look at is how can we support this person? How can we wrap people around this person so that they can get better and they can do well and get better? So why bring up the ACEs study? What does this mean for kind of talking about COVID is that I think sometimes we make a lot of black and white blanket statements that if we're making kids wear masks, then bad things are going to happen. Or, COVID should be another ACE that we should look at. And so what I wanted people to recognize that even though COVID is a horrible thing and it's really challenging, and even mask wearing causes a lot of uncomfortableness and discomfort, it does not guarantee or mean that people will get mental health problems or that people are going to start to struggle. In fact, you might have people during this COVID that have actually thrived and gotten stronger. Maybe families started to kind of do more things together instead of the busy lives. I know that was kind of characteristic of our family in terms of it. Now, don't get me wrong, there are definitely things that we've kind of had struggles with in terms of COVID and the impact it's had, but there are things that have actually come out of it that haven't actually been bad. They've actually been good. That's the same thing with mask wearing. Now, mask wearing isn't kind of our ideal. People are not wanting to do that, but those are decisions that our schools are making. So in order for kids to be able to go to school, because actually it is going to be much worse for kids to be home, not necessarily just for academics, but kids being isolated and actually humans being isolated and not being able to connect with others has really damaging effects on our development and on our growth. So we want kids in school. A lot of kids are being held back because they're falling so far behind on remote learning. It's just not for everybody. Although there might be kids that thrive with remote learning, and that's great. There's a lot of kids that don't. So we know that a priority is to have kids in school. I know from our perspective, running Life and Purpose Behavioral Health, it is our priority to have people able to work and provide care so people can get behavioral health services from us. That becomes a really important thing. Ultimately, what we're learning and what people are, certainly encouraging is that wearing masks can reduce the spread, especially when we're around those that are not able to be vaccinated, especially around kids in under 12 that cannot be vaccinated. And also being around people that are immunocompromised, that we want to do our best to put the protective factors in. And that's the thing. The impact of COVID has a lot to do with, what protective factors do we have in place. Some people are going to have lots of health problems related to COVID because they're going to contract COVID, and it creates a lot of problems. And especially if they've been hospitalized and things like that, what are the protective factors? So like getting the vaccine, that's designed to be a protective factor, just like all the vaccines that we had to get as children, so that we don't get those diseases that were from years ago that we had to, as a country, as the world, try to deal with. So in anything that we're doing, how can we change the trajectory of the way we're experiencing things like COVID? Can we put protective factors in place so that COVID doesn't have the impact it has as in terms of quarantines and people getting sick and people dying and things like that? Same thing with ACEs. I'm not going to be able to eradicate trauma in the world, although that's a great goal and we want to do that. But we can certainly put a big dent in that and reduce the likelihood of trauma by putting protective factors in the homes of families, in the community. And that's really, should be a priority for our community and our society. In my experience in working, or just even being on social media, which isn't always the greatest thing to do, is, that people have actually gone out and said masks are going to cause mental health problems for kids. Now, there's probably, if you look at things globally, there's probably a likelihood that it could create mental health problems. But I would push back and say that mask itself does not create the mental health problems, but how we use masks and how we introduce masks and the way kids experience the mandate of mask wearing will be what determines mental health problems. And so if we go back to kind of how I define stress of, building resilience, if things are predictable, if they're moderate, and if they're controlled, then we can build resilience. So can we make the idea of having kids have to wear masks in schools predictable? Absolutely. And I think a lot of us have done that. We've done that as parents. Schools have done that. Although maybe that mandate happens quickly, we have definitely had that experience of, talking to kids about the purpose of masks, why we do it, what's the goal, what are we trying to accomplish. And I know, like, from my daughter who's on the volleyball team in the middle school that she goes to, the team itself, even before the mask mandate happened, they said, we care so much about our team and our season that we don't want people quarantined. So, we're going to wear masks when we're not on the court. And so they collectively as a team made a decision that, for the betterment of our team, we're going to make masks. So they collectively made a decision. Now, that, of course, is certainly the way we would want it, right? If we don't want people mandating us to have masks, but we would like to be in charge of our own decision, right? We want to be able to make our own choices about it. The unfortunate thing is we collectively as a society or as a community cannot make a decision without government intervention, right? So we can't collectively come together as a society and say, hey, we think it's important to listen to what the CDC is recommending and following that. People don't want to follow that. People are not cooperative with those mandates. Same thing with vaccines. The CDC is recommending that vaccinations is our best way to eradicate COVID-19, but we don't have everybody getting vaccines. And we can't collectively as a society come together and make that. Now, in small groups like a volleyball team or a small agency or whatever, I'm sure those can happen. We have to have pockets of discussion. So I know someone I work with talked about her church strongly recommending that collectively we wear masks. Not mandating, but strongly recommending. And sure enough, a majority of the people wore masks. And that's really, can we as a community, can we as a society come together and make a decision about what's going to help resolve this crisis? Because when we can't, that's when the government steps in. Because you know what? Hospitals are overrun, ICUs are full. We are closing down surgeries because, they have no beds for people to stay overnight. And so that's what happens when we as a community and as a society can't manage it, people step in. And that's kind of the way our world works. And, that's unfortunate, and everybody wants us to have control. But that is also something that we can deal with in a way that builds resilience. Yes, we don't like that it's a mandate, but it's a mandate and we have to deal with it. So for kids, going back to the kid example, because kids are my passion and I work a lot with kids, and I train a lot of people in terms of kids, is how can we make mask wearing predictable? Even if they don't like it, how can we make it predictable? How can we tell them, informing them, giving them full, we have a thing in the mental health world about informed consent, that we're going to fully inform you about this process of therapy. And so that you have choice on how you have some control on how you want to do it. So it's fully informing kids about this process. And if there's a barrier and if there's a struggle and if the child is having a really hard time with it, we as adults should talk them through it and see what is the barrier, what is the concern that the child has. And I think that's another thing, is that many of us are expressing a lot of concerns, or we're expressing being anti-vax or anti-masks, and it's usually probably for a really good concern. There's probably a really reasonable concern behind those comments, but we're not actually talking about the concerns. We're just saying we're talking about the solutions. So we're only thinking about the solution of no masks, no vaccines, instead of trying to address the concern. I'll give you an example. On the news, one of the school districts mandated masks for the children, and a parent was on the news and was complaining that there's no AC in the school, and then my kid has to wear a mask. That's a problem. Yes, that's a very big concern. Totally agree with that. If it's really hot and muggy and there's no air circulating in the school and I have to wear a mask, then that is a problem. But that's a concern. And it is also a concern to, number one, to ask the board, but it's not a reason necessarily at this point to say that masks shouldn't be worn, because if I can solve that concern, then masks can be worn. If I can say, no, all our schools have air conditions, which most of them do, that I'm aware of, there's air conditions in the window. It's not central air, but you know what? There are air conditioning. I've been in most schools in my area, and there's air conditioning to some degree. And it's also getting to the point where it's not mid-July, heat. And things are cooling off a little bit. So we want to make sure that we address that concern. Now, if there was no way to address that concern, then yeah, we would have to come up with a different plan. But that's not the case. Someone else brought up kind of a petri dish, that masks are a petri dish for kids. Well, yeah, that might be very true. But there's also a concern that we want to look at. Okay, so maybe there needs to be more disposable masks, and we need to change those masks on a regular basis. We have to kind of, if you don't have disposable masks, we need to wash our masks on a regular basis. We need to look at what resources we have for kids to get masks. So all those things are really important concerns and should be expressed, but doesn't mean that that's a reason why we shouldn't do something that's going to be for the betterment of the community and try to reduce the spread of COVID and then reduce the spread of quarantine, right? And that's the biggest thing about why these mask mandates are happening, is how do we keep kids in school? Because if we're spreading COVID like wildfire, we can't keep kids in school. So kids are quarantining, and so kids are missing school. So we want to keep kids in school. We know that's important. So that's why the masks are being worn. They're not wearing masks is only going to make schools shut down. And I know for a lot of us, that's going to be a big concern. And it wasn't healthy for us when we had to do it in the beginning of COVID, and it won't be very great for us as a community to be stuck at home and to do remote learning and to be disconnected from everybody. So, that's going to be really, really important. Lastly, I want to say is it moderate? So if predictable and then moderate is, how can we make the stress of wearing masks moderate and not overwhelming? So that really is dependent on each kid. We all experience this stress differently. Some wearing masks is not a big deal. Some people it's going to be a big deal. So for the people that feel like it's a big deal, how can we give breaks? How can we regulate? How can we do things that are going to reduce the impact of wearing masks? For kids that handle it really well and don't really have a problem with it, we probably still want to help them have breaks and make sure it doesn't get to a point where it's overwhelming. But those are things that we can problem solve and look to. And then control. Can we give kids choice on the type of mask they want to wear? If they can, have opportunity to be a part of the discussion and get their concerns heard. Those are all important things. And then that stress is not going to be as bad, and it's actually going to build resilience. So that's a really important thing that we want to keep in mind when we're talking about masks and vaccines. Ultimately, we have to come up with solutions. We have to build in protective factors so that kids don't have to quarantine, people don't have to quarantine, people don't get COVID, or if they do get COVID, it doesn't affect their health to where they need to be in the hospital, need to be on a ventilator, and all those things. So until we collectively as a community can really build in those protective factors, we're going to still struggle. We're going to still not get through COVID very well. And that's not good, right? We want to get through this. We want to get back to normal life. And I think that's really important. So, but I know it's hard, and I'm not trying to kind of dismiss any of it because I know it's hard. Mental health is often characterized by the struggle to do what's good for us. How many of us know that there are things that we should be doing better, whether it's eating well, whether it's exercising, whether it's not drinking or using drugs or whatever. We know that there are things that we should be doing that's better, but we really struggle to follow through with that. We struggle to really get into a good habit of doing healthy things. And that's one of the biggest challenges in mental health, is being able to do things that are helpful and useful for our well-being. Most disorders in the DSM basically illustrate a lot of maladaptive coping by us, right? So for depression, it's usually because we're coping with sadness in a really maladaptive way. We're not getting out of bed, we're eating too much or not eating at all, we're sleeping too much or not sleeping at all. Things are happening that are making it hard for us to cope. So we have to make the unpredictable stress more predictable, and we have to kind of acknowledge that there are going to be certain things that are not going to be great, but we can actually put things in place to buffer the suck, right? We want to buffer the suck. We want to make sure that we know that wearing masks is uncomfortable, or we know that being distanced or dealing with some of the policies that are in place are not going to be fun. But what buffers can we put in place that are going to make things better for ourselves? So, in conclusion, in the end, what do we do? The best thing I can think of, at least and from my recommendation, is the best thing we do is put more protective factors in place. Protective factors like masks, vaccines, or masks when you are not vaccinated. If you're not vaccinated, wear masks. So that's a protective factor. More people that are vaccinated, the less likely we'll need to wear masks. I'm hoping that we can avoid those mass quarantines. So if we want to improve our mental health, we have to be able to stay connected, be socially connected, and not have to isolate. Find healthy ways to regulate, whether if exercise is that for you, movement, watching funny shows, connecting with loved ones, finding ways, healthy ways to regulate and feel better. And then focus on the greater good for the health and safety of our community. Find compassion and understanding for those that want people to get vaccinated and wear masks, but also have compassion and understanding for people that are uncomfortable with wearing masks and getting vaccinated. We have to have compassion for everybody. We can't live in this world where it's black and white, either on this side or on this side. We have to be able to come together and support each other and help people make the right decision on what's best. But if we're not going to get vaccinated, then what does that mean? If we're not going to wear masks, then what does that mean? What does that mean for our society? And is that going to be good for us? if people have if people have discomfort or are uncertain about the vaccine, let's help them get more certain about it by getting more knowledge. And maybe it makes them more certain not to get it, but at least we're going to research out that information and get it from the right source. And then ultimately we have to have more love and caring for us. Love and caring across political affiliations, across religious denominations. We have to have love and caring for everybody. And that's how we're going to get through this, because when we start thinking outside of ourselves and thinking about the greater good, that is what's going to get us through this global crisis, because this is not an individual crisis. This is a global crisis. And so we have to globally come together to fight this crisis. And so we have to come together and figure out a way to have good discussions about what's going to help us get through this, and be able to be open-minded to information. Now, if someone has better ideas that's going to get rid of this crisis, I'm hoping that people will express them, because there might be other ideas. But at this point, the ideas that we've heard are get a vaccine and wear masks when we're around people that can't get a vaccine. So I know I said a lot, and some of you guys might agree with what I'm saying, some of you guys might not, and that's okay. That's kind of the idea, is to be able to share and express ourselves and be able to express it in a way that's respectful to people that disagree, and then it allows for people to also kind of share their concern. But what I would like is that people share their concerns and not just come up with solutions to problems that have not been identified, because and the solution can't just be don't do this, don't do that. We have to come up with what are things that we can do to make things better. So if it's not wearing masks and vaccines, what is an alternative solution? How do we keep kids in school, keep kids safe, keep people safe, keep the hospital beds low in terms of use, and keep people from having to go on ventilators and people from dying? What can we do? Going back to the ACEs study, the answer is not to just we have to do something, because we know the impact that ACEs can have on our health and well-being. So we want to put protective factors in. And if we don't, then we're going to continue to have more people in trouble, more people unhealthy, more people at risk. And so that's not, the answer is to not do, is not, I'm almost going to do a double negative, but the answer is not, we don't do anything. The answer is we have to do something, but what is going to be best for us as a community? And so, right now, being able to support each other and care for each other and help each other and respect each other, I think is a good place to start. So thank you guys for hanging with me today, hearing what my thoughts are in this. I hope people found use out of kind of understanding how to build resilience and being able to take something that is really stressful and build resilience from it, by creating a good pattern of good stress and being able to experience it in a way where you have some control over it. And I hope people stay healthy. I hope people are able to stay connected with each other. And I hope people get the help if they need it, reach out to kind of know that there are resources out there and people out there that want to help. So take care.